I'm Peggy Peck. It's been almost 6 years since the Women's Health Initiative was stopped when it became apparent that postmenopausal women randomized to a hormone replacement regimen of estrogen plus progestin had an increased risk of breast cancer, increased stroke, increased deep vein thrombosis, and increased pulmonary embolism, and no decreased risk of cardiovascular disease. But the data from that trial of more than 16,000 women keeps coming. The latest finding, reported today in the Journal of the American Medical Association, was once again not good news for supporters of hormone replacement. Dr. Robert Wallace, an epidemiologist from the University of Iowa, was one of several WHI investigators who followed the women for 3 years after they had stopped taking hormones.
This is a randomized trial, it's an experiment, and that gives us a fair degree of certainty that this was related to the drug. There was about a 15% increase in mortality among women on the drug after the drug was stopped.
But Wyeth, the pharmaceutical company that supplied the pills used in the study, doesn't think there is really much news at all in today's report, as Dr. Gary Stiles, a cardiologist who is chief medical officer at Wyeth, explained here.
After we have thoroughly reviewed this paper, we really don't believe that this latest article provides any new guidance for women who are making decisions today. And let me explain to you why I say that. First, we continue to recommend that hormone therapy be used at the lowest effective dose for the shortest duration of time. We also firmly believe that hormone therapy remains a good and viable healthcare choice to relieve moderate to severe menopausal symptoms, including hot flushes, night sweats, and vaginal atrophy, and to help prevent the postmenopausal osteoporosis for appropriate women. Importantly, it's important to point out that the women who participated in WHI were very different from the women who typically use hormone therapy today. The women in WHI initiative were predominantly non-symptomatic women and were on average 63 years of age, which, as you also know, is more than a decade past the average onset of menopause. Today, our clinical guidance advises that women take low doses of hormone therapy for symptomatic relief at the onset of menopause for the shortest period needed for symptomatic relief. And for this, the clinical guidance is, as best we can assess, routinely followed. In recent years, there's been reanalysis of the WHI findings that have shown that the increased risks associated with the older women, as described in this study, were not consistently shared by the younger women who participated in the study. The selective release of this information in individual packets over a period of time must be considered getting increasingly confusing and out of step with our current clinical practice to the general public who doesn't read this data in journals every day. Publishing an ad hoc analysis such as this one, without providing the full context of the data that is assessed, including the detailed findings, we do not believe is in the best interest of menopausal women and may needlessly cause confusion. As I mentioned, Wyeth continues to recommend that women work proactively with their healthcare providers to find the best option for the relief of their menopausal symptoms.
I'm Peggy Peck, MedPage Today.